we're gonna manually muscle test internal and external rotation. So, get this, I'm just supporting the scapula here. So with internal rotation, I'm making sure that I'm supporting and holding all the muscles that I need to palpate with that stationary arm, and then I call this my resistance arm. You're gonna resist that movement, okay? So this is where it can get really hard for your brain, but you're resisting here at the forearm, okay? This is the only one where you're not just distal to the joint that you're testing, because if I'm resisting here, it's not giving me the information I need. I need to resist the movement, okay? So internal rotation is this movement, so I'm resisting here, okay? So I'm gonna bring her to about midline. This is really about midline of what you have available, but okay, I'm gonna bring her to midline available, and then I'm just gonna say, hold your arm in that position, okay? So, good. So that looks about normal. What you might see in terms of compensatory movements in internal rotation is they're bringing their whole, it's like they're resisting abduction and adduction, okay? So you wanna make sure that you're just resisting this movement, this rotary movement, okay? So I try to support everything. I'm supporting the humerus here with my thumb. I don't know if you can see that. And then I'm just asking them to hold this position. Good, okay. So gravity eliminated for internal rotation is seated. You're just gonna have them, you're gonna support the elbow, and you're just gonna have them bring their hand to their belly. Okay, hand to belly. Good. And sometimes you may need to just support out here. The hard thing is you can't see really full if you have someone with a large pannus. So you can maybe bring it out. It's really difficult to look at gravity eliminated internal rotation if they have some sort of block. Like, it would be very difficult to see internal rotation on me because I have a restriction there. So you just have to kind of make do. For external rotation, you manually muscle test in prone. So if you can come. All right. Make sure that everything is aligned, legs aren't crossed, and their head is turned. Okay, so hold on. I'm gonna bring her here. I'm gonna support all the muscles here, and I'm just gonna say, can you push up into my hand? Push. Let's do it this way so you can see a little bit better. Push up into my hand. Push, push, push. Oh my goodness. You're a little bit limited here. we might be a 4 here. Okay. So she's really only holding against mod resistance. Good. Okay, so you're just resisting that movement here at the midline of the forearm. Okay? Make sure you're supporting this whole, not supporting, that's not the word that I want to use. Make sure that you're able to palpate all the muscles that are involved in the movement, okay? And then again, seated for gravity eliminated. In external rotation, you're just gonna hold here and you're gonna ask them to bring their arm out. And again, my restriction here. Okay, so bring your arm out. Good. Good, so she has full range of motion and gravity eliminated for external rotation.